Is there a coder in these offices? And there wasn't. Not every clinic had a coder.
Was there a moment or a realization that made you want to launch Healthcare Inspired?
We had in our system what we call queues. And so
How would you describe the impact that you're trying to make?
definitely don't want to work for free, but the impact is truly with,
What's the mood out there among healthcare admin professionals?
at times, these individuals don't always understand what it's like.
As far as the future goes with these revenue cycle, can you give us an idea of how you would recommend people should do that?
It starts with your team. We interview the whole team, figure out what their strengths and weaknesses are, which is confidential. And then
What are you seeing as far as AI goes?
the history of AI, where it's going in healthcare, and we can't stop it. All we can do is
Hello and welcome to Healthcare Journeys. I am your host, Kevin Rosenquist. Thanks so much for joining us today. Behind every accurate claim and compliant record is a professional who understands the language of healthcare and someone who taught them how to speak it. My guest today is Jennifer McNamara, founder of Healthcare Inspired LLC. With decades of experience as a medical coder, educator, and consultant, Jennifer is helping healthcare organizations build stronger teams and smarter systems through customized training, audits, and ongoing support. Jennifer, so good to have you here. Thanks so much for being with me.
I am honored to be here. I am just excited to be invited on this show and have a chat with you about what I do and what I love.
Yeah, I'm excited to unpack this with you. You've got an interesting career. You kind of went from, you've worked in almost every corner of the coding and compliance space. Was there a
Yeah.
moment or a realization that made you want to launch Healthcare Inspired?
Well, I think about that often. And the other day I was just kind of walking myself back through my history and remembered this moment. So I was working as a coder in one of the jobs that really launched my career in orthopedics. And I was doing prior authorizations. I was doing coding. I was the checkout girl. I was the girl that asked for your payment at the end, or the one that made your next appointment, all in one. And we had in our system what we call queues. And so whenever the claims would come back, maybe denied or rejected, we were working them. My bucket was pretty much clean all the time because I always worked it. I didn't have many errors. I had some, but then I was asked to help other clinics because mine was always so clean. I had time on my hands. So I could not believe how many errors were coming through on these other organizations. And then I just happened to one day ask a question. I was like, is there a coder in these offices? And there wasn't. Not every clinic had a coder like ours did. Like the primary care clinics, some of the other clinics didn't have a coder. So all the physicians were coding. So only like surgical offices at that time had coders. So there were so many claims just rejecting all the time. And I was just, there has to be a better way.
Yeah.
So short story of like just fixing the issue that came through, I thought over time, there has to be a better way. So I kept reaching and, trying new things. One day I decided I'm not able to solve this issue working in the role I'm in now. I have to go to a different level. And so I just kept moving, trying new things, and eventually decided to take a leap and said, here I go. I'm going to try to make a difference. And hopefully organizations that are struggling will realize that I can actually provide solutions.
Wow. So that's interesting that there were so many issues with the coding that came in. Was it lack of knowledge? Was it lack of funds? Like or was there a combination of things? Why were these so messed up?
Well, there are some of that I can answer, and some honestly to this day I couldn't answer because of the role I was in. But what I see in organizations is a lack of staffing, qualified staffing, or proper training is always the issue. And that's one of the things that we do at Healthcare Inspired. We've always put as the primary focus is education, training, not only for physicians, but also for the teams that support the physicians. So it starts at that first encounter, the front office, you make the appointment, getting the correct data. And so we really looked at that. That a lot of times is what makes or breaks it. A lot of the rejections were coming from incorrect insurance information, not understanding that the patient has a Medicare replacement plan and not just Medicare. There's all kinds of things just on the data of the patient itself that causes these things. And then you dig into the coding. There's a lot of guidelines. They change every year. They change quarterly. So if you don't know the new updates, and recently my partner and I went to Chicago to visit one of our clients, and that was one of the issues, was lack of training. And so just to us, the small changes we thought were small changes that just easy to fix resulted in millions of dollars in revenue.
Wow.
And it was just like insane. And at that level, you're like, okay, this is working.
Yeah, this is needed.
It's just things that we know to do that they didn't. And
Yeah.
it's just a matter of turning that switch on and saying, these are services you're already doing, you could be getting paid for. And they didn't even know that these codes existed, or didn't know that a small change could make a huge difference. And so that is the kind of thing that I saw way back when, that now I'm able to actually see a true difference in an organization and help them stay open, which is the goal.
And there's a good amount under the hood for what you got, for what Healthcare Inspired does. You got education, audits, consulting, mentorship. How would you describe the impact that you're trying to make?
Well, honestly, we definitely don't want to work for free. We want to make money, obviously, but the impact is truly with the people we work with. We love making connections with real people that are also trying to make a difference. So healthcare is a service, yes, but it is a service that is necessary for society. We all get sick. We have to be able to trust entities that we go to for healthcare. So when we're a patient, we want to go and know that the person that we talk to knows exactly how to help us get from the front office to the doctor and get better. And then we come back and we check out, and then we get our bill, right? So that's another part of the healthcare journey that a patient doesn't want to have to deal with. They're trying to heal. So we want to make that process a little more efficient so that the patient doesn't have to think about that stuff. Now, at the end of the day, yes, they're still going to have to think about it, but the stress needs to be taken off of the organization, off of the patient, and let someone that really understands the language of insurance companies to take that on, because that's the issue, is they just don't understand how to deal with the insurance company, how to interpret their policies, things that are to us just second nature, that to a physician and to some of the people that work there, just to them it's second language. They don't understand. So that's what we want to do, is make an impact, take the pressure off. Patient care should be the only thing they focus on.
As someone who just had a hospital stay after falling off of a ladder, I know it's something I know all too well.
Sure.
Yeah, I didn't have the capability or the mental capacity to deal with anything related to insurance or anything till just recently. I was just like focused on, hey man, get better. So I totally understand what you're trying to say.
Yeah, my cousin, he was in Colorado skiing and he injured himself, and so he texted me. He's like, "Hey, can you look at my bill?" Because it didn't look right. Because of course he was in Colorado, so it was out of network technically. And so I was like, before I dig into this, let me research a little bit. But then I realized what he sent me was not a bill. It was just a notice of what they're going to bill the insurance. So I told him, I was like, "Don't stress out. You don't owe anything right now." I was like, "These prices look scary, I know." But so I explained to him the whole process of like, wait till your actual bill comes, then show me, and then I can maybe work with you. But right now, don't freak out. These prices are not what you have to pay. These are just what.
And that's a very, very good point, and something that happened to me too. I went,
Yeah.
and yeah, you're right. It kind of comes in waves, and you just got to wait till you get the actual bill. So yes, that's good point. For anyone listening, don't panic.
Right.
I wanted to talk a little bit about, the workforce strain behind the scenes. Clinician burnout gets headlines, but coders, auditors, they're having their own burnout issues as well. What's the mood out there among healthcare admin professionals, and what do you think might be missing from maybe the national conversation?
There's a lot of levels to that. I will say that from an administrative side, they're burdened down with a lot of things. trying to focus on their priorities, with what they care about first. I throw out PE as an example, private equity firms having to take over organizations. And you have management companies that come in and purchase a practice and to help them manage it better. And at times, these individuals don't always understand what it's like in and out every day of working for an organization. So there is the stress of, even coders and billers being managed and being told to do things a certain way that doesn't coincide with the actual rules they have to follow. And I think there's a disconnect sometimes with what a supervisor might know. Maybe they have a great education. They came from a collegiate environment and they know stuff about running an organization, but maybe not a healthcare organization. And they're still learning, right? They have a degree and they're great at managing, but they don't necessarily have the skills to manage a healthcare team. So that can be an issue. And where you have somebody that doesn't have a healthcare background trying to instruct you on how to do your job. There's a lot of tension there I'm seeing and hearing from people. And then you have those that do have that education trying to help people that have been there 20, 30 years. We've always done it this way. It's always worked.
Right. Yeah.
And so those are the conversations we have. Well, has it though? Have you tracked the workingness of this? And so when I ask physicians that, they say, oh, we've always done it this way, we're good. I was like, when's the last time you tracked the payment from these visits you're talking about? That has always worked. When's the last time as a physician you've actually gone back and tracked that payment? Did you get to keep it? Do you know that for sure? Or is someone just telling you that?
Yeah.
Everything's fine?
Yeah. Well, that brings up another thing too, because the you can call them legacy systems or whatever, but a lot of different industries are really slow to move forward with technology, and healthcare is certainly one of those, and tracking the data. Like there's so much data we have access to now, and we get more and more with AI and all that stuff, but yet sometimes people just are like, well, if it ain't broke, it's like, but to your point, are you sure it's not broke? Are you sure it's not at least breaking? Like you don't know exactly where you are until you really look at the data.
Yeah. It's fractured. Let me tell you, it's fractured. I know fractures. I work in ortho, so I know what a fracture looks like. So again, yes, it is a broken system in many ways. And then we have things that stack on top of us, the bureaucracy on the insurance side. And I see a lot of physicians and those getting frustrated. They're leaving hospital organizations because of the mismanagement. They try to go work concierge and not take insurance. And that may work to a certain extent, but not every patient can go to a physician and pay cash. No. So they get insurance from their employer. They want to use it. So you can be successful even as a private physician in your own practice, because that's the kind of people we help every day. Is we work mostly with private organizations. We do work with hospitals on bigger projects, but we do mostly work with private owned organizations to help them stay in business. And it is doable because our clients are doing it well. And they're coming to us for things less and less sometimes because over time we've given them the resources and the tools to do it well and to see the results. So our knowledge coupled with their knowledge, it's a super team. It's this dynamo, I call it, of collaboration. And collaboration is what needs to exist more and more. I'm not against private equity. I'm not against the help to dig people out of their hole, as long as they're working as a team. And as long as the results at the end of the day show patient care is better and the numbers are showing that revenue is coming in clean.
And to your point earlier, know your role. Like if you're a private equity firm, make sure you get the right people in there who actually know, you're good at what you do, but you may not know anything about all this other stuff. The gazillion other things that go on in a healthcare organization. You got to have the right people there, or contract with people like you in order to get that right. And something you said before about the doctors wanting to go elsewhere, one thing that you have to think about is education as a tool to retain talent, not just onboard them. Correct? How are smart organizations rethinking training as part of like an overall workforce strategy?
Well, another thing that we're seeing too on the training front is not complicating it, because I feel like over the years you try to complicate it. We have to do this, 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 and this. We're required to train you on this. There is required compliance training that all organizations required to have because they bill Medicare and Medicaid. The Affordable Care Act made that mandatory. You have to have a compliance plan. It has to include that element of education and training, but it doesn't have to burden everybody. It can be what we call micro learning, right? And so that's what we're doing in our education is and you see reels on Instagram, all kinds of organizations are promoting these new micro learning tools. Like, you don't have to do hour-long presentations anymore where they have to sit for 30 minutes, 45 minutes for a presentation. You can make it easier to digest. So video emails where you have a specific training moment you need to give because your audit showed a certain result, that this is a risk area. So you send out a video email. This is something we need to address. Please make sure this is happening. Or like a maybe 5-10 minute video on just that issue, where it's not necessarily you have to wait 6 months to get education. Make it fluid and make it constant.
And
so
quicker. We all know people's attention spans are dwindling very, very rapidly. So yeah, like to your point, don't make it a 45-minute presentation.
No. And for our conferences we're doing this summer, they're virtual. We always do virtual conferences, but we're implementing the same thing. No more 45-minute conversations. We're doing more panel discussions where we have experts coming on instead of like a slide presentation. It's just chat. It's just conversation.
That's so much more interesting.
It's so much better to have that kind of content in your events because it's engaging and it gets to the root of why they're there. Why they paid the money to come to your event is because they want these specific questions answered. And you have to cater to your audience, not to what you want to talk about.
Yeah, we've all been in those conferences where your eyes roll back in your head because you're tired of by the time you get to the 50-second slide, you're like, oh my God.
Exactly.
Totally agree. Panel discussions are you get more out of it. It's more engaging. It's more entertaining. It's just a better product.
Absolutely.
What are you seeing as far as AI goes? You know, it wouldn't be a podcast if we didn't talk about AI, right? Like every episode, I feel like every podcast out there talks about AI at some point. Is it going to be revolutionizing as far as medical coding goes? What's the story from your perspective? Do you see it as a tool or a threat or combination?
Not a threat, a tool for sure. An ally, a efficiency model that is needed because of the volume we're seeing now. People may or may not realize this that don't work in healthcare, that maybe know what telehealth is because they've used it. But when you get into the world you're working in every day, you feel the impact. Since 2020, we felt the impact of the increase in medical visits because of telehealth. So there's a volume increase. And so we need technology to help us be more efficient so we can focus on the volume. Now, coders will always be needed. We need the human brain because the computer is only as smart as what you tell it to do.
Right. So just repeating. Yeah.
Yeah. Artificial intelligence has been around since like the 50s, technically. The actual technology. It's evolved a lot over the years. A couple of years ago, I went to the HIMSS conference in Chicago. When he was there, is the tech conference, one of the tech conferences that exists for healthcare, tech. And I met a lot of great people. One of them in particular that I met was really heavy in technology and really talked about the history of AI, where it's going in healthcare, and we can't stop it. All we can do is our best to make it compliant and, prevent it from doing things that harm the result, right? The people and, the data. But it can help you as long as you're doing your job to stay compliant. Now, we have issues with people, wanting to use ChatGPT for everything. And I'm not going to lie, I love ChatGPT. I use it every day.
So do I. I use it a lot.
I use it for social media. I use it for email writing.
Great for that stuff.
Pretty coherent and I know how to write, but every once in a while I have like this random thought at like 12:30 at night and I just don't know how to process it. So I just throw it in ChatGPT. Tell me how to say this because this is what I want to say.
I do the same thing.
It just happens. And so you can use it for that. We do have to create compliance policies specifically for ChatGPT now in healthcare because people have the tendency to want to throw an opt note in there or throw in a documentation there to have it code for them. And that is not acceptable. But
Mhm.
that's an area that we're of concern, is controlling the use of it, and in organizations, making sure your teams don't use it inappropriately. You can use artificial intelligence to process documentation. Physicians are using it in the clinical side. There are some EMRs, electronic medical records, that are pretty well known that use a certain technology that have a disclaimer that artificial intelligence was used to in the note to
Mhm.
describe what was going on. So they are using it. The main thing that we care about on our side of the fence is that the physician has actually validated what is being reported. So if they're using artificial intelligence, I'm all for it to be efficient, because it can pull information, clinical information, research material. The physicians can actually process a lot more data with AI, because it pulls information that they will probably have to take maybe longer to find. If they're doing research before they
Absolutely. Yeah.
finally diagnose a patient, they may have to do a lot of research, right? So this technology can process a lot of information quickly and accurately, but as long as it's clear, the physician agrees and it's authenticated that they actually read what the AI said, and they
And double
confirmed correct.
checks important stuff.
Because end of the day, it's their tax ID, it's their NPI number on that claim form. They are attesting that they read it and they agree with it. And that authentication is what they're licensed to practice medicine for. So, like,
Mhm.
they're saying, I'm licensed, my decision is this is good for the patient, and I authenticate this. So that's what needs to be confirmed. And then we're all good. As long as you confirm what it came up with, you agree with.
Yeah, it's really great on the front end, right? You just can't rely, like, just, summarizing long texts or documents or PDFs or all that. It's so good at that stuff. But yeah, I've had it still to this day, like, it still hallucinates. And there's still times where
Oh,
I'll be like, where did you get that information from? And they'll be like, and it'll actually say, oh, good catch. That was wrong. And I'm like, what?
well, absolutely. Yeah,
Still
I
does
mean,
that. So
it does it every day for me, and I have to retrain it. So I work in orthopedic spine, excuse me. And so I have a lot of complex data to go through.
yeah, I bet.
So when I go through the data, I'm looking for specific information. And sometimes it's like, I think that's what they're trying to say. So I will take like a phrase and be like, is there more information out there you can find me on this particular, diagnosis, or this particular phrase? Because sometimes they're saying something in a way I don't understand. And that's typically what I'll do. But it's still, sometimes I don't agree with it. So
Hmm.
it just depends on what they're telling me.
Hmm. As far as the future goes with these revenue cycle, or the revenue cycle workforce, if you could kind of just go in or advise organizations on how to build and support their coding and billing teams from the start, can you give us an idea of how you would recommend people should do that?
Absolutely. Well, I'm going to say 100%. You got to get the right technology in there. But again, it starts with your team. So
Mhm.
one thing we like to do is go in and meet the team you currently have and have a conversation with them privately. I did this with another practice and it worked great. So we interview the whole team, figure out what their strengths and weaknesses are, ask them what they like and don't like about their job, which is confidential. And then we write reports and recommend necessarily, what we find. And so one thing that we do find sometimes is that sometimes the person in the front seat shouldn't be there.
Yeah.
They don't have the customer service mentality. They need a job. Yes, we don't want them fired. We want them to keep a job. But maybe there's another role in the organization that's better suited. So one thing we find is some people are really good at talking to insurance companies and can get things done. But they're not necessarily the personality that should be talking to patients, because they're not
Yeah.
patient, right?
Yeah. They don't
And
have that. Yeah, totally.
so
I know what you mean.
so we got to switch them. And so that happens and it works great. It works excellent because you want people who have empathy and that are naturally people, right? That can engage with those patients and make them feel comfortable.
Yeah, because
And
a lot of
maybe
times
those
patients are
ones that can,
calling and they don't know what's going on, or they're confused, or they need to be like, I don't know, like they need to be led a little bit. They need to be comforted in some way.
Absolutely. I mean, you're in pain. Like, you don't want someone to, make you feel like you're the problem. You want to make sure that you're valued, right? And so we train the front office staff to have those skills. And at the end of the day, we also train them, you may have a bad day, but you need to not bring that to work, because your job is to make someone else feel better. And so you can cry when you get home. Just when you get to the office, just be the person that you need to be to make that patient feel better. And
Right.
so that's one thing. And then we have another class where it's so important. Physicians and coders need to be meeting together. They need to have every quarter, as often as you can, have them meet together, because there is a huge disconnect between those roles. And we actually have guidelines that tell us physicians and coders should have a relationship. The organizations that put together our coding manuals actually put it in the book, in the guidelines, that physicians and coders need to have a relationship. So we strongly encourage no more telephone, the game telephone, where someone tells you something, and then by the time it gets to the next person, it's completely different. These office managers need to stop triaging every single question that a physician has. Train your team to talk to a physician, and they can be trained. I mean, some people, yes, they need the training to communicate at that level so they can understand the question, but they should have a relationship with their physicians and know how to talk to them, and not be afraid to have a conversation with the physician. They're real people, and they're not to be feared, most of them, I would say. They need to have that relationship. So that's how you can support your coding teams. Give them that connection, give them resources and training. The training we offer is relatively inexpensive compared to the losses you're experiencing by not having it.
Yeah. That makes sense. All right. Well, Jennifer McNamara, thanks so much for being here. Hey, you're a podcast host too, right?
I am. I love podcasting. I'm sure you do too. And it's nice to be on the other side sometimes and experience.
Do you want to plug your podcast? What do you got going on?
So yeah, every Wednesday we have a podcast, Practice Perfect, with my co-host Maya Turner. And we really this is like our third podcast together. And so we decided just to make a new podcast that's all about helping practices succeed. So every week is a new episode about practice management, making, changes. This week we talked about, the top 10 billing myths. We're going to have another bonus episode on burnout, just things that we deal with all the time. So it's a great way to get education for everyone in the organization, not just coders and billers, but everyone who has a role. We touch on everything. So it's a good time.
Awesome. All right. Well, Jennifer McNamara, CEO of Healthcare Inspired LLC. Thanks so much for joining me. Really appreciate your time.
Absolutely. Have a good one, guys. Thank you.